Hello and welcome, everyone. My name is Angela Doinsala Aina, and I'm the co-founder and executive director of Black Mamas Matter Alliance, or simply BMMA. We are glad to have you here today. In honor and recognition of April 11th as International Day for Maternal Health and Rights, BMMA presents today's program presentation titled Black Maternal Health Across Regions, which is meant to showcase a global community committed to the health, rights, and dignity of Black mamas everywhere. Before we hear from our presenters, we'll showcase our Black Maternal Health Week welcome video.
Black Maternal Health Week is here. From April 11th through April 17th, Black Mamas Matter Alliance invites you to join us and our partners around the world for the 2026 Black Maternal Health Week campaign. 2026 is a significant year for BMMA as we mark 10 years of establishing the global Black Maternal Health Movement. We have worked alongside Black mamas, families, birth workers, advocates, researchers, and organizers to sound the alarm of the rising maternal mortality rates, confront inequities in maternity care, and lift up community-driven solutions rooted in birth and reproductive justice. This year's BMHW 26 theme is Rooted in Justice and Joy. It honors the imperative leadership of Black-led perinatal, maternal, and reproductive health organizations that continue to cultivate healing and transformation across communities. We carry the full truth of what systemic oppression and reproductive injustice have meant for Black mamas and birthing people. And in that truth, we root ourselves in justice, restoration, and joy. Not as promises for someday, but as what this movement demands today. Throughout the week, join us for virtual conversations, in-person gatherings, wellness-centered spaces, policy engagement, and community celebrations that reflect the full spectrum of Black maternal health. Black Maternal Health Week is more than a moment. It is a declaration that Black mamas deserve to thrive. Take a look at what we have in store this year. Join us by signing up for our newsletter at blackmamasmatter.org/connect. Follow BMMA and our alliance partners across social media, and be sure to join the conversation using the official campaign hashtag BMHW26.
For those of you that are joining us for the first time, let me take just a moment to tell you a little bit more about BMMA. Black Mamas Matter Alliance is a network of Black-led and Black women-led organizations and multidisciplinary professionals who do the work of programs, care, services across the full spectrum of perinatal, maternal, and reproductive health. And we do this work deeply rooted in the birth justice, reproductive justice, and human rights framework. Our mission is simple and it is urgent to ensure that all Black mamas have the rights, respect, and resources to thrive before, during, and after pregnancy. We are and serve as the premier Black maternal health professional organization, building skills, convening, and mobilizing the global Black perinatal, maternal, and reproductive health workforce to end maternal mortality. BMMA does this work in 4 core areas. We work to change policy using the human rights framework to address health injustices and inequities to improve Black maternal health outcomes. We cultivate research and evaluation to leverage community knowledge and Black scholarship to build the evidence base for this work. We advance care, in particularly holistic full spectrum care, respectful maternity care, and comprehensive and maternal and reproductive health approaches. And we work to shift culture by dismantling negative narratives about Black motherhood and amplifying the voices and experiences of Black mamas throughout all the work that we do. When we use the term Black mamas, we use that term with intention. BMMA uses the phrase Black mamas to include a range of people, that cis women, trans folks, and gender expansive individuals who are all people of African descent across the diaspora. We also include those who care for and mother our families in our communities, whether they have given birth or not. So our aunties, our elders, everyone, we stand in solidarity with all Black mamas. 2026 marks more than 10 years since BMMA was founded, right here in Atlanta, Georgia, at the Mother House in West End. This milestone reflects a decade, little over a decade, of strengthening Black-led perinatal, maternal, and reproductive health organizations. This has been a decade of advancing policy, shifting narratives, and driving systemic change at all levels. Since our founding, BMMA has helped lay the groundwork for many initiatives, including the Congressional Black Maternal Health Caucus, and has been nationally recognized by the White House under the Biden administration, in particular, our Black Maternal Health Week campaign. And so what started as a project became a movement, and that movement is now global, which is exactly what today's program is a testament to. Black Maternal Health Week is an annual week-long campaign founded by Black Mamas Matter Alliance in 2018. It takes place each April during National Minority Health Month, and this year it runs through, and every year it runs through April 11th through 17th. We open the week today on April 11th to join global organizations in marking the day as International Day for Maternal Health and Rights. Also, in more recent years, we also mark this day as Black Doula Day. It is an opportunity to advocate for the elimination of maternal mortality worldwide and to center the voice, lived experience, and community-led solutions of Black mamas and birthing people. This is the 9th year of the Black Maternal Health Week campaign, and it falls within BMMA's 10th anniversary of establishing the global Black Maternal Health Movement. We are proud of how far we've come and clear-eyed about how far we still have to go. This year's theme is rooted in justice and joy. This theme honors the fullness of this movement, the fight for structural change and accountability, and the healing, cultural traditions, and community care that have always sustained Black families. Justice and joy are not separate. They are the roots of everything we do. This is a celebration of movement building, of the strength and resilience of Black-led perinatal, maternal, and reproductive health organizations that have carried this work forward year after year. And at the same time, this theme acknowledges the enduring systemic oppression and reproductive injustice that our communities continue to face. We hold both of these truths together, knowing that joy is not a luxury, it is a birthright, and it is a practice of liberation. Now, let's get into today's program. I am honored to introduce the voices you're about to hear. We have brought together Black maternal health advocates from across the UK and Canada, and each of them is doing extraordinary work. We'll now introduce them. Up first is our speaker, Althea Jones, a registered midwife and the founder of Ancestral Midwives, a Black midwife led, not for profit based in Ontario, Canada. Althea has dedicated her career to improving the outcomes and experiences of Black people during the perinatal period, centering access, empowerment, and culturally competent care for Black families. In her segment, Althea speaks to what Black families face when navigating the perinatal care system in Canada and how Ancestral Hands centers birth justice in its work and what it means to practice as a Black midwife.
Black Maternal Health Week is an opportunity to reflect on the realities Black families face when navigating perinatal care in Canada. Despite publicly funded healthcare, systemic barriers continue to impact access, experience, and outcomes. Many of these challenges remain underrecognized due to gaps in race-based data, making community-led solutions more important than ever.
I'm a registered midwife, founder and executive director of Ancestral Midwives. We're a Black-focused midwifery clinic. We offer culturally safe care. I see Black midwives, Black clients, and we're just trying to have the best outcomes and experiences possible. I wanted to open the clinic because I didn't see enough Black clients taking advantage of midwifery care, which could definitely be part of the solution to the Black maternal health crisis. Because when I thought about it, it's like, well, why aren't Black people coming here? When you walk into a space, you don't see anybody that looks like you. None of the resources look like you. It doesn't feel like you belong. In healthcare, there's a lot of equity issues. There's a lot of gaps in the data. But whenever we do have the data, Black people are doing poor, and we need to do something about that. There are lots of gaps. We actually don't collect a lot of race-based data here in Canada, which makes it really difficult to get funding and resources and support for clinics like this. That's a big issue, and that needs to change. At the same time, we also just need to start believing community and stop telling us to prove through statistics and research and studies what we already know to be true. Like at some point, just say, you know what, we're listening to community need and we will support you to do this work and figure out how you can best serve your community. But in terms of the research that's out there, anytime we do have race-based data, we see that Black folks are having poor outcomes. And so things like preterm birth, preeclampsia, always at higher rates. In terms of chronic disease, Black folks have earlier onset of those things, which makes them disproportionately ineligible for things like midwifery care. So there's an access issue as well. So to make a long answer short, there's a lot of gaps in the data, but whenever we do have the data, Black people are doing poor, and we need to do something about that.
For healthcare professionals, addressing Black maternal health requires acknowledging both data gaps and lived experience. While race-based data in Canada is limited, existing research consistently shows disparities in outcomes. At the same time, Black families often face barriers to accessing care and report not feeling heard or supported within the system. These challenges point to the need for both structural change and more culturally responsive models of care.
This is Samuel. I don't know if I didn't have ancestral hands, I don't know what I would do in my actually my delivery. At one point, his heart rate was going down, and I thought I was gonna have a C-section. They were able to walk me through everything. They were there in the hospital, like literally holding my hand, being supportive there for me. The obstetrician, seeing that I was supported by Ancestral Hands midwives, and then seeing that I had that support, they were more so inclined to try more natural ways and to listen to my wants and needs. And when I couldn't, they were advocating for me. They were able to be my voice when I couldn't speak. And even afterwards, they were there too, and coming to the house. And it's just the care. I've never experienced that before.
I'm Alexia Singh. I'm a registered midwife here in Scarborough, and I am the clinical director here at Ancestral Hands, and I take care of the clients. Ancestral Hands Midwives is so incredibly special because the racially concordant care is what makes a huge difference. We understand where clients are coming from. We understand the journey that they have experienced, and we're here to listen and to be a part of that. And so clients really have an opportunity to talk about whatever is on their mind. And I'm not just talking about asking questions and the things that come up between appointments, but I'm talking about bringing up their traumas, bringing up their history, And I think that's the big difference, is that they feel comfortable and they feel safe.
It's awesome. It's a beautiful place. I felt the warmth, and right from the reception, the smile the receptionist gave me made me feel that yes, I'm at the right place. Generally, the skin color can make you feel neglected in a way, especially when you're not able to communicate or you feel someone is not listening properly to you. The people here, they're ready to listen to you and provide adequate and quality care, which is very important. If you're able to solve my problem, you have to start from listening, right? And here you get that here. It's a safe haven. It's like home away from home.
Advocacy, I think, really starts with the client, helping them be informed, knowing their rights, knowing that they can say no, that nothing can happen without their consent. So I think it starts really in the clinic room. And then kind of beyond that, it's really just being involved in as much as we can, sitting at as many tables as we can so that the community has a voice. Because that's the one thing where often in leadership spaces, there's nobody that looks like us. So who's advocating, who's telling that story, and who's supporting the community in those spaces. So for myself, it's been a matter of getting into those spaces. So my role as the president of the Association of Ontario Midwives puts me in front of the Ministry of Health, where I get to have those conversations, and then I can bring that to community as well. So I think it's multifaceted. It's doing some policy work, but it's also kind of just community outreach as well, being involved in community, hearing those needs, and then being able to, say it and talk those things when you're at those other tables.
Birth justice is about more than clinical care. It's about ensuring that every person has the right to safe, respectful, and culturally appropriate care throughout their pregnancy and beyond. It centers informed choice, autonomy, and whole person care, while recognizing that systemic inequities must be addressed to truly improve outcomes. It also means telling the truth that you cannot transform what you refuse to resource. Black-led models cannot continue to be celebrated symbolically while being underfunded structurally. If we believe Black maternal health matters, then Black-led midwifery, Black-led perinatal care, and Black-led health infrastructure must be funded, protected, and scaled.
Every birthing person knew that they have a choice. Like across the board, everything is your choice. Nothing happens to your body without your consent. No is a full sentence. And also, you have options.
Let me tell you how to advocate for yourself if you're by yourself. Let me tell you, talk to your partner or your parents or your support people about how they can support you and advocate for you if we're not around. And that all goes into how we provide care, because we're actually listening to them. We have the time to be able to really provide one-to-one person-centered care. And often Black folks within the healthcare system have never experienced that.
I think there just needs to be more decisions made that focus on the whole person and not just kind of treating a specific aspect or treating pregnancy as like a specific time, but understanding that, pregnancy and good health during this time really does lead to healthier communities, because that person has a healthy pregnancy, learns to advocate for themselves, learns to show how they should show up in healthcare spaces, and then they do that same thing for their child. And so having these positive interactions with the healthcare system really does make healthier communities. So I think, the main change is resources and just kind of community building, meeting people where they're at and making sure that they have the understanding of knowing their rights and being able to advocate for themselves out in the healthcare space. Hands to be a Black health hub. I want a building. I want it to be a multidisciplinary space where, yes, like the center it starts with pregnancy, but it goes far beyond. I want doulas, I want obstetricians, I want mental health support, social work. I want everything that people need for holistic health. And so I want people to see through Ancestral Hands that you can offer care in a different way, and that people really can get the support they need, and that it can be how the standard of care is kind of across the country.
At Ancestral Hands Midwives, we know another future is possible, one where Black birthing people experience care that is safe, dignified, culturally grounded, and rooted in trust. One where Black-led models are not treated as exceptional, but as essential. We are building that future now. That's why our vision is bigger than a clinic. It's a model of care and a model of system change. Through culturally safe, community-centered care, we are creating space for better experiences and better outcomes. Learn more, access care, and support the work to help build a more equitable future for maternal health.
Next, we will hear from Sandra Igwe, founder and CEO of the Motherhood Group UK. Sandra has built a powerful platform for Black mothers in the United Kingdom through community convenings, conferences, and a podcast series that centers and amplifies the real voices of Black UK mamas. Her work creates the spaces Black mothers deserve, spaces of community, visibility, and power. Please welcome Sandra.
Safe spaces around everyone as well. Welcome. Hospital. I'm just thick. Sandra, you need to I black the house. Have no find funding act. The medical not is fine, but there needs to say who said. Motherhood group. So including my married then get sick first.
Hello, my name is Sandra Igwe and I'm the founder and the chief executive of the Motherhood Group. I am honoured to be joining Black Mamas Matter Alliance for Black Maternal Health Week 2026. Thank you for bringing together organisations across the diaspora working to improve maternal health outcomes and support for Black mothers globally. The Motherhood Group was created and founded in 2026 following my own personal lived experience of postpartum depression and maternal isolation and birth trauma. At the time, I struggled to find culturally relevant support, and I realized that Black mothers like myself, we were navigating motherhood without feeling seen, heard, or supported. And what started off as a small WhatsApp group quickly grew into community, into a movement, and today the Motherhood Group has evolved internationally, supporting Black mothers through community, advocacy, research, innovation, systems change, and digital support. And at the heart of our work is centering really the voices of Black mothers, because too often decisions are made about Black maternal health without Black mothers being included in those very conversations. We create spaces where mothers can share their lived experiences and where those voices directly influence change. Through peer support, listening sessions, storytelling, and community engagement, we amplify the voices of Black mothers and ensure that our experiences inform policy, services, and research. And over the past decade, we have delivered a number of flagship programs and initiatives. We host the largest Black maternal health conference in the UK, convening healthcare professionals, policymakers, researchers, and mothers. And over the past 3 years, we have brought over 3,000 attendees, creating one of the largest, most important national spaces and dialogue for Black maternal health. We also lead Black Maternal Mental Health Week UK, a national campaign dedicated to raising awareness, sharing lived experiences, and promoting culturally competent support for Black mothers. We produce Black Maternal Mental Health Report, the UK's largest report of its kind in the UK, bringing together lived experiences and evidence to highlight the urgent need for change. And our Make Black Mothers Visible campaign included national billboards and powerful short film highlighting the experiences of Black mothers, which aired nationally on the news and helped bring Black mothers' health into mainstream conversations. And we also have Black Mums Go to Parliament, creating opportunities for Black mothers to directly engage with policymakers and decision makers. Now, alongside this, the Motherhood Group contributes to national policy and systemic change. We have fed into the National Maternity Investigation and continue to contribute through the Health Expert Reference Group and wider task force discussions focusing on improving maternity outcomes. And this ensures that lived experiences is not just heard, but also embedded into policy strategy and service delivery. And we also expanded our work through our digital innovation. We created Mumbright, formerly known as Black Mums App, a platform designed to really help mothers find support, connection, and culturally inclusive care. Now, Mumbright brings together mothers, counsellors, therapists, and practitioners in one accessible space. Now, our goal is to build belonging, reduce isolation, and increase access to culturally competent services. Community remains at the heart of everything that we do, through events, through conferences, through support groups, and through partnerships. We create space for connection, belonging, and empowerment. Thank you for the opportunity to share our work and to continue building this global movement together.
I've experienced pregnancy loss where they tell you that there's no heartbeat and your heart sinks at the same time. My experience with my twins 6 months ago was different. After a couple of pregnancies that ended in loss and miscarriages, I was blessed enough to be pregnant with twins. Couldn't believe my luck. When you experience loss before that, it makes you really hesitant to share the news. You delay it a lot more. You don't run out and tell everyone after the first scan or the second scan. So me and my partner really waited closer to 4 or 5 months before we started sharing it with slowly and incrementally with parents and siblings and cousins. I just about told my team at work I was wearing the biggest XL men's shirts and outfits you could possibly imagine while I'm trying to run up and down and stand in front of a team without them knowing. My second to last day was amazing. All my team, they bought gifts. It was the first time I've received baby gifts, etc. So I went to bed super happy, not realizing that in a few hours' time, the beginning of a nightmare was going to start. And I went into what they call PROM, which is premature rupture of the membrane, as twin one had lost their water. I went to hospital. I was in there pretty much for a month. They told me I'd be giving birth within 24 to 48 hours, so I might as well let them induce me. I was not about to give them my baby. Once I worked out that my kids were alive and they were well, they would stay in there until they chose to come out. I didn't realize that was going to take a month of fighting and arguing and protecting myself, correcting incorrect information like my gestational ages, trying to dodge people, tricking me into getting an induction, giving me the wrong medication, teams of doctors day after day storming in, who let this lady continue her pregnancy. That's not what the book says it's supposed to be. That's the fight for your life, right? You don't think for 1 second when you go into motherhood and being pregnant that actually you're going to war.
Yeah.
My first twin was born 8th of August. I cleared the room of all medical staff. I had my partner and my mum with me. I tuned in to myself as a woman and I delivered my baby Enoch's asleep. 11 days later, a few infections later, I developed early on sepsis, which I didn't even know what that was. Thought it was like maybe another COVID. So I was like, no, I'm going to ride the wave until I hit 22 weeks because that's when they told me they would be able to proactively intercept medically to try and keep her alive. Unfortunately, 3 days prior, I got early on sepsis and it was either I let them induce her or I go to NICU, and I had a responsibility to my family too. So she, even though they said she wouldn't be, was born alive. And because she wasn't 22 weeks, was left in a basket on a bed opposite me to pass away in her own time while I was taken to theatre for them to remove both placentas because they didn't come out.
We are also joined by Dr. Josephine Etowa, full professor and Canada Research Chair in Advancing Black Women's Health at the University of Ottawa and Director of the Co-Create Lab. Dr. Ottawa's work uses community-based participatory research to center the African, Caribbean, and Black community in the design and production of knowledge that drives real change. In her segment, she speaks to the state of Black maternal and perinatal health in Canada through a research lens and what solidarity across the diaspora looks like from where she sits. We'll now hear from Dr. Etowa.
Hello, everyone. Thank you for joining this global conversation for Black Maternal Health Week 2026. My name is Josephine Etowa. I am a nurse scholar, a community engaged researcher, and an advocate for health equity. Today, I would be talking to you about perspectives on Black maternal and perinatal health in Canada. I'm currently Canada Research Chair and full professor in the School of Nursing Faculty of Health Sciences at the University of Ottawa. I would like to begin by acknowledging the indigenous lands on which I live and work and to honor my ancestors. I'd like to start with this quote, "I am because we are." African philosophy of Ubuntu quote, which speaks to our collective resilience and collective work and accountability. So I acknowledge that African, Caribbean, and Black people live and build community on unceded lands across Canada. Today, I am in Ottawa on the unceded territory of the Algonquin Anishinaabe Nation. I honor First Nations, Inuit, and Métis peoples for their enduring stewardship of this land. And in the spirit of African tradition, I offer libation in words, or honoring the ancestors whose strength and sacrifices guide us. I recognize Africa as the cradle of humanity and celebrate the contribution of African, Caribbean, and Black communities worldwide. As we mark 10 years of the Black Mamas Matter Alliance, we celebrate a global movement rooted in joy, in justice, in healing, and in community. Here in Canada, that movement continues to grow through Black Maternal Health Week in Toronto and Black Maternal Health and Reproductive Justice Month in Ottawa. This month is reflected in a key milestone here in Ottawa. On March 11, 2026, Mark Sutcliffe, the mayor of Ottawa, proclaimed April as Black Maternal and Reproductive Justice Month. I would like to speak to three key areas during this presentation. So first, I'll talk about the state of maternal and perinatal health here in Canada. Second, why community-centered research matters. What global solidarity look like from a Canadian perspective. Let's start with the background. Racial disparities in perinatal health are not accidental. They are connected to the foundations of modern obstetrics and gynecology, which developed within the context of anti-Black racism and enslavement. Elevated levels of medical mistrust among Black women are not irrational or unfounded. They are rooted in histories of exploitation, stolen bodily autonomy, and intergenerational trauma. As Bradley 2023 argues, the historical subjugation of Black mothers should not be ignored. Instead, it must inform how we understand contemporary disparities in maternal and perinatal health. In Canada, 23% of women experience maternal mental health disorders, with Black, Indigenous, and other racialized people accounting for 40% of reported cases. Depression affects 55.9%, nearly 66% of Black Canadians. That's 6 times the annual rate in the general population, and Black women are the most impacted. So why does this conversation matter? Because Black maternal health is a global equity issue. Persistent disparities across global high-income countries. It's an issue that needs to be addressed. Canada is often seen as being equitable, but that perception does not reflect the lived realities of many Black women. There is a deep gap between the promise of universal health care and the reality of equitable outcomes. This is why this conversation matters. In terms of defining maternal, Black maternal and perinatal health, really, when we're talking about maternal, we're addressing the whole spectrum of pregnancy, childbirth, and postpartum. And perinatal health acknowledges both the mother and the baby before and shortly after birth. All these processes during this period are influenced by structural racism, social determinants of health. When we talk about the many things that are not biological, they are shaped by the social conditions, access to care, and importantly, structural racism. So an intersectional lens is important when we are looking at this issue. Black women experiences are shaped by multiple systems of inequality at the same time. So this emphasizes the issues or intersectionality of race, gender, migration, income. They all compound to create the problems that we're talking about in terms of maternal health. So the problem here in Canada, Black maternal health inequities. Black women in Canada face higher risk of poor maternal and infant outcomes, whether it's preterm birth, low birth weight, admission into the neonatal intensive care unit, hypertensive disorder, gestational diabetes. These are all issues that affect Black women. And so, despite Canada's universal healthcare system, research, including those from Black scholars like Priscilla Boyatis at the Toronto Metropolitan University, begin to show some of those consistent worsening of outcome, issues around obstetric racism. And the Voices Unheard report also recently completed a survey of over 2,000 Black women across Canada, recently completed by our colleagues and leaders in the community. The Black Women Institute for Health also points to some of these inequities. And even our own work here at the Co-Create Lab, the Collaborative Critical Research for Equity and Transformation in Health Research Lab, speaks to some of the structural racism and the lack of culturally safe care women receive. So how do we move forward? Here in Canada, we've also recognized the need to change. The solutions are clear and actionable, and many are already being recommended by Canadian researchers, such as my own team here at the Co-Create Lab, from a recent study funded by Public Health Agency of Canada. We talk about the need for better data. You cannot fix what you cannot measure. Race-based data must be standardized across systems, like Born Ontario, the Birth Outcome Registry in Ontario, and also national organizations like CAHI, Canadian Institute for Health Information. We must also be culturally safe and anti-racist. This includes training providers, addressing bias in clinical decision-making, building trust with Black communities. We must also invest in community-led solutions. Black-led organizations already provide culturally appropriate care. Doulas and midwifery models have shown some strong outcome. And finally, we need policy leadership and accountability. A coordinated national strategy for Black women's health is needed, and clear targets and reporting mechanisms in terms of accountability is so important for this. And so these disparities we're seeing among Black women are preventable, and addressing them requires intentional, equity-focused action at all of these 4 levels. And I just want to again touch on this, that racism is not an isolated event. It is systemic. It's based in those bias in clinical decision-making, dismissal of pain and concerns of Black women, underrepresentation of Black providers, and policies not designed for diverse population. I just want to highlight again some of the insights from our work here at the Co-Create Lab, research lab here at the University of Ottawa, that specifically examine perinatal mental health of Black birthing people over the last year. We highlight the lived experiences in healthcare system. They point to the significant gap in terms of the navigational burden. Self-advocacy is necessary, however, people need to be educated in terms of how to navigate and interpret complex healthcare system. Effort is needed in terms of where they can position themselves to be heard. Experiences of discrimination and medical mistrust, the presence of key strengths were also highlighted in the study: resilience, community support, and cultural knowledge. These strengths are important assets that needs to be recognized and supported. And I would just like to use direct quotations because we examine the lived experience qualitatively. For example, what this person talked about how they feel when they go to these healthcare services, and somebody said, yes, people are judging based on the fact that I was too young. They felt I wasn't married at that time and that I wouldn't be able to handle a baby or even have the physical strength or capacity to push a baby. So yes, people are judgmental. They're judgmental talks. Another person pointed to the fact that I think that when they see Black women, they automatically think that we are stronger than others. And you're young, so they just won't take you seriously. Again, this quotation speaks to some of the feeling of being judged and the cultural context that Black women find themselves when they go to receive care. Here in Co-Create Lab, that again, our work is grounded in co-creation, in anti-racism, in equity. We see communities as partners, not as participants. Our work is community-centered, and so we engage in research with communities, not on them. Shared decision-making throughout our project is a key element of how we engage in work. And so co-designing and co-developing projects, programs, advocacy in the community is a key element that drives the work we do in terms of the process we engage in. Why does this matter? Because it leads to more relevant, culturally safe, and impactful research. It helps address harms of extractive research and improves outcome by centering Black women's voices. This is just some of the examples of our work here. This is the report and that you can access online. We have a webinar series going on online and a module on perinatal mental health. So we encourage you to visit our website at cocreate.com. Next, I just want to touch on the whole issue of global solidarity. Black maternal health inequities exist across the global diaspora, whether it's in Canada, in United States, in the United Kingdom, and beyond. Global solidarity is essential, and it includes working together, sharing knowledge, aligning our advocacy effort, learning from each other to mutual learning. Solidarity must be action-oriented, not just symbolic. Working together and encouraging and pushing each other. How can Canada play a role in this? Canada has a role in this global movement. We can contribute through our research, through the community modules we currently use, and through policy innovation. But we can also contribute by listening to what is happening in other places. We must listen to our global partners. We must learn from movements rooted in Black feminism and reproductive justice. So I finish with our call to action, to move forward, to invest in race-based data, to fund community-led research, to train providers in anti-racist care, and to build global partnerships. This requires a shift in power, a shift in resources, and a shift in accountability measures. So in conclusion, Black maternal health is a human right, is justice, and global issue. Equity is not aspirational, it is an obligation. And Black maternal health in Canada, the health inequities that exist in Canada is real and documented. And so we must move forward to address this global issue as an obligation. Thank you.
And finally, we'll hear from two members of the Black Maternal Health Collective Canada, Jennifer Dockery and Akua Asabia Blair, both advisory committee members of the BMHCC. The Black Maternal Health Collective Canada, or BMHCC, made history when their collective effort led Toronto's City Council to officially designate April 11th through 17th as Black Maternal Health Week, in alignment with Black Maternal Health Week here in the United States. We are honored to have been part of their inspiration, and we are proud to amplify their work today. Now we'll hear from Jennifer and Akua.
Recently, I navigated the healthcare system where I felt very scared and overwhelmed because it was my first time having my son admitted to the hospital for a long period of time. I had to see my child lifeless, not himself, and just really sick overall. Hearing the doctors and nurses speaking to me and all of the medical terminology did not help in that situation. When you're already by yourself and having to make medical decisions when you're already in a state of being overwhelmed is a lot to handle. And I feel like there should have been somebody that could advocate or an interpreter to break down the medical terms in a more understanding way to help make more informed decisions for the health care of your child. My advice to young Black mothers navigating the health system for the first time is to really speak up for your child.
Hello everyone, my name is Jennifer Dockery and I am the Vice Chair for Black Maternal Health Collective Canada. I'm also a registered nurse by background and I have worked in various sectors of the healthcare system. I had my career started though as a neonatal nurse, so I have a real passion for maternal newborn care.
Hello everyone, my name is Igwe Blair and I am the President and CEO for the Abiona Center for Infant and Early Mental Health. I'm also a member of the Black Maternal Health Week Collective for Canada.
So, Igwe and I are very excited for this opportunity to walk you through the events that are going to take place in this second annual Toronto Black Maternal Health Week. It's a week dedicated to initiatives that bring together healthcare professionals, community organizations, and advocates to raise awareness, provide education, and promote equitable access to quality maternal health care. This week-long event will feature expert-led panels, seminars, interactive workshops, and community discussions, all focused on addressing the physical, emotional, and mental health well-being for Black mothers during their pregnancy and the postpartum period. The second annual Toronto Black Maternal Health Week will take place April 11th to the 17th. The theme for the Black Maternal Health Week is moving from awareness to accountability, the role of families, allies, and systems in Black maternal health. So to kick off Toronto's second annual Black Maternal Health Week, we are going to be doing this with an inspiring opening ceremony grounded in this year's theme, from awareness to accountability, the role of families, allies, and systems in Black maternal health. We'll be joined by community leaders, birth workers, families, and allies as we open this powerful week dedicated to truth-telling, celebration, and collective action. First, look at the events happening across April 11th to the 17th. Together, we'll be honoring Black birthing people and a call for partners and systems that are needed to advance safe, equitable, and affirming maternal care. We're going to start this week with intention. The movement begins here.
April 11th, there will be Minifest. What is Minifest? It's a racialized reproductive and maternal health conference that is taking place at the North York General Hospital on April 11th. This year's theme, Navigating Data and Systems in Perinatal and Reproductive Healthcare, will bring together healthcare professionals, researchers, advocates, policymakers, and community members to advance equity and innovation in racialized perinatal health.
We move over to April 12th, which will be Midwife Day. And this will be held by Ancestral Midwives, who are hosting a community baby shower at one of our recreation centers in Scarborough. It's going to be informative. It will be a supportive way of gathering, designed to celebrate new and expecting parents and equip them with essential baby supplies, educational resources, and a strong network of community support. The event will bring together midwives, healthcare professionals, and clients for informative panel discussions and celebration.
April 13th will be the Practitioners Roundtable Day. As part of Toronto's Black Maternal Health Week, the North York General Hospital will bring together leaders, clinicians, and advocates to advance the conversation on maternal health equity in partnership with Black Physicians of Canada and the Black Physicians Association of Ontario. The afternoon will begin with a moderated roundtable discussion featuring key voices in healthcare and Black maternal health. The conversation will focus on the opportunities and challenges involved in driving systemic change to address health disparities facing Black women and their families, including the importance of increasing diversity among healthcare providers.
Then we're over to April the 14th, where we're going to have a fireside chat. This will be an evening event, and it is being sponsored by Castles, Brock, Blackwell, LLP. The fireside chat is a signature event for the Toronto Black Maternal Health Week, creating space for meaningful conversation around the lived experiences of Black mothers within the healthcare system.
We are honored to welcome acclaimed Canadian soprano Misha Bruger-Gossman-Lee, who will share her powerful personal story and a journey through motherhood and maternal health. Through an intimate and engaging conversation, this session will explore the themes of resilience, advocacy, and the importance of equitable and compassionate maternal care.
Francophone Day, April 15th, 2026. An online event, Care Adapted to Race and Culture. A Francophone experience is what you can expect. This interactive online session invites participants to reflect on how culture, linguistic, and racial diversity shapes the maternal health journey. Through guided conversations, we can explore challenges, needs, and opportunities for building a more inclusive and equitable healthcare system for Black Francophone women. This session is designed. We hope the conversation will be guided by key questions. What is culture and racial diversity? Why is culturally adapted care important? And what is the role of healthcare professionals and the healthcare system?
April the 16th, we will launch Research Day, advancing evidence, equity, and accountability through Toronto's Black Maternal Health Week 2026. This year's theme, From Awareness to Accountability, the role of families, allies, and systems in Black maternal health. Hearing from leading researchers, emerging scholars, clinicians, and community partners as they share new findings, challenge assumptions, and spotlight solutions that advance equity in Black maternal and perinatal health. The keynote talks to community-engaged research showcases. Research Day brings together the people generating knowledge and the systems responsible for acting on it. Be part of the movement to turn evidence into accountability and accountability into change.
Final day, closing day, a public event open and it will be held on April 17th. The closing ceremonies for Black Maternal Health Week will highlight the voices of young Black mothers, their experiences through pregnancy, birth, and postpartum, while honoring the unique path they navigate as young parents. The morning will also explore the role of allies and systems who support and celebrate young Black mothers on their journey, offering thoughts and action to move from awareness to accountability in our services and system. Thank you to the Black Mamas Matter Alliance. Thanks for allowing Toronto to participate in this global event. We're really grateful for the opportunity to share with you all that's happening in our beautiful city.
And a big thank you from me to Black Mamas Matter Alliance for allowing us to be able to showcase the great work we're doing here in Toronto to drive advocacy and action and accountability as it relates to Black maternal health. Thank you.
Thank you so much to all of our presenters today. What you have just witnessed is what this movement looks like when it travels, when it crosses borders, oceans, and time zones, and when Black women show up for each other, no matter where we are in the world. This is Black Maternal Health Week, and we are just getting started. Black Maternal Health Week 2026 is a full week of programming, events, and activations led by BMMA and so many of our alliance partners across the nation and around the world. Today's program is just one part of it. Later on this week, we look forward to having our Black Maternal Health in Your Neighborhood virtual pep rally coming up on April 13th. Then our next in-person event, which is our Black Maternal Health Professionals Networking event here in Atlanta, Georgia. And then on April 16th, join us virtually for Beyond the Binary, Black Trans Family Building in a World Not Built for Us. And then on April 17th, we're going to be holding a community remembrance and healing vigil right here in Atlanta, Georgia. Again, you can get involved with Black Maternal Health Week right in your local neighborhood by looking up some local events happening across the nation at blkmaternalhealthweek.com/events. And you can peruse the hashtag BMHW26 on social media to also find local activities for Black Maternal Health Week that's happening and led by a lot of wonderful organizations. Before you go, I want to leave you with some ways to stay connected and keep this momentum going. Find a Black maternal health organization in your area. Attend their events, panels, and trainings. Know who is doing this work near you. Donate to a Justice and Joy Walk team and put your dollars behind the mission. You can do that by visiting blkmaternalhealthweek.com or blackmamasmatter.org/donate to find a team that moves you. Build intentional relationships with Black-led and Black women-led perinatal, maternal, and reproductive health organizations beyond this week. Volunteer and give of your time and skills where you can. You can also sign up to be a volunteer with BMMA. And then we ask that you amplify the work of this week's campaign using the hashtag BMHW26. And then also you can go to our website, our Black Maternal Health Week website, and download the official toolkit. There's so many information in that toolkit and plenty of social shareable graphics that you can use to amplify this week's campaign. Remember that our theme is rooted in justice and joy. Be sure to stay connected. Follow BMMA on all of our social media platforms. And then, of course, if you want to keep up with all of the wonderful work that we do across this movement of Black maternal health, please sign up for our newsletter at blackmamasmatter.org/connect. This movement belongs to all of us. Thank you for being here. Thank you for caring. And thank you for continuing to show up each and every day for Black mamas, because it takes all of us to engage in the fight to actually end maternal mortality. Thank you.